Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today is Amanda Fondren. Now, of course, Amanda's from Omnis Health Clinic. Today we're talking all about gout. Welcome to the show.
Thank you.
You never hear about gout anymore. I don't know why. What is gout?
Well, gout is a condition that affects the musculoskeletal system. Causes a lot of pain.
It does?
Oh, yeah.
More for men or women?
There's a lot more men that have gout, but women can have gout too.
What's the cause of it?
Well, what causes gout is when the body breaks foods that we eat down into, through the normal breakdown process, into uric acid crystals, and those uric acid crystals get trapped in joint spaces.
Oh, so it's more of a feeling of non-movement within the joints?
No, it's really more almost like you have an infection because it gets very red and swollen.
Oh, wow.
But it's not an infection, it's just an inflammatory response.
I remember as a kid, my father saying he had gout. Can I honestly tell you, as an adult, all I can think about is I'm going to get gout. Is it an hereditary thing or a dietary?
It can be both. People who have a family history of gout can tend to run in the family, but people who don't have a family history can get it as well.
Really?
Yes.
Is it, if we were to cut out bad foods, I remember my father couldn't eat seafood. Mm-hmm. Am I correct in saying that?
Yes.
I remember, because I remember a conversation, and then when I used to see him eat a prawn or some crab, or I'd be thinking, oh, it's bad for your gout. Do you know what I mean?
Right. Well, there's plenty of other foods too. The main thing is the foods that break down into purines, beer, red meat, things like asparagus. There's certain things that break down into purines and then break down into uric acid and form crystals.
So this is something that we really do need to look at when it comes to our diet. I'm sure we can find out from people like you what foods not to eat that will eliminate. Will that cut out the issue of when it comes to gout? If we were to get rid of all those foods out of our diet, all right, which sounds pretty harsh, especially most men like a beer. You know, on a hot day, I know I love a cold beer after a hot day. But is it something that can be reversed, or you can eliminate it if you make those changes?
Well, you can certainly decrease the incidence of it. And a lot of people can eliminate it with diet, the risk of getting a gout flare-up. For people who even controlling their diet tightly, there are pharmaceutical medications that can then prevent that even further.
And that's what I wanted to ask you. I'm sure there's a lot of pharmaceutical drugs that one could be taking to help gout. But I just want to keep trying the natural stuff.
Yeah, I agree.
You know, is that so bad?
No.
We put so many things in our body from, you know, hormones in foods and all these things that we may or may not know we are eating. Natural remedies can work.
They can help, definitely.
When we start doing, let's say, prescription drugs, okay, how soon do we see the release of gout symptoms, or it just masks it?
It doesn't mask it. It actually breaks those uric acid crystals down and causes the symptoms to go away. And then the inflammation will follow as the uric acid leaves the joint.
Explain to everyone at home, again, what the feeling of gout is. So I'm sitting at home listening to you, and I all of a sudden go, she's right, I've got gout.
Pain, swelling, redness. Like for somebody who gets gout in their foot, the bed sheet can't touch it. It hurts so bad. It's pretty painful. Oh my gosh, it's that bad? It's that bad. Okay, well, what I know is I don't have gout. Thank you. Good. I don't need to Wikipedia myself. Right. You know I do. That's the problem of doing all these interviews. I bet you do. Thank you, I do. And we appreciate everything you always do. Thank you so much. If you want to find out more information, there it all is up on the screen today. We've been talking to Amanda from Omnis Health Clinic, and of course, it's about gout, something we don't talk enough about. Back after this short break.